Worried by the high rate of maternal mortality in Nigeria, the stakeholders in the health sector gathered here to profile ways of bringing the issues of funding for family planning on the table of political leaders, especially the candidates who are going to emerge as winners of the 2023 general elections. The stakeholders at a one-day summit in Abuja, organized by the Association of Nigeria Health Journalists (ANHEJ) and supported by the Partnership for Advocacy in Child and Family Health at Scale, anchored by the Development Research and Project Center, harp on the importance of preventing women from dying while giving birth. Ugochukwu Alex, a Deputy Director of Family Planning Logistics, who represented the Director and Head of Reproductive Health Division at the Federal Ministry of Health, however, advised health journalists to continue to keep their members and the general public well informed on issues around improving reproductive health system.
I also urge the association and all other stakeholders to continue their collaboration with ministry to enable the country improve the indices in healthcare delivery.
Speaking, the chairman of the Association for the Advancement of Family Planning, AAFP, and focal person of the Family Planning, FP 2030 in Nigeria, Dr. Ejike Oji, noted that in order to reverse the ugly statistics of maternal mortality in Nigeria, that government at all levels must provide maternal health services free of charge. On his part, the Director, Partnership for Advocacy in Child and Family Health at Scale, Dr. Stanley Okpai, pointed out the need for media to maintain the advocacy for the use of contraception to manage population growth in the country.
Women die in pregnancy. The under fives in those households have 5 times propensity to follow that woman and die. So that's almost 500% that child probably will follow the mother and die. And that's why if you look at the statistics, Nigeria has one of the highest infant mortality in the world.
I think it's something that the new administration can begin to consider, how to manage the population so that the people that we produce in Nigeria contribute to the productivity of Nigeria.
Oftentimes, candidates of various political parties running for positions do not include in their manifestos how to tackle health challenges in the country. And the president of ANHEJ, Hassan Zagi, wants health reporters to remind political leaders the major issues around family planning.
Candidates, let me surprise you, may not know all these issues. Despite that, they are going to campaign here and there, but they don't know the magnitude of these issues. So it's our responsibility as journalists to enlighten them, to raise our voices. We can't keep quiet any longer. The issue is going out of hand. So we must raise our voices and let them know, so that when they come to the offices, they will now know exactly what they are up to do.
The theme of the conference is raising voices for more funding for family planning and free maternal health services by incoming political leaders. Basil Okafor, Core TV News, Abuja.